After my first miscarriage, I felt completely dejected, very depressed. I also remember actively thinking that if this ever happened to me again, I wouldn't survive it. And then it did. I'm 34 weeks pregnant now. Mental health has been a big component of my journey to motherhood. The lens through which I experience every single thing in my life is that of a Black woman. I was doing more translating of my experience with my doctors, none of whom were Black. It was extremely important for me to have a Black doula.
I love back.
That person who was going to be able to advocate on my behalf, who also understands that lens through which I view the world.
Chelsea's mental health was super important. It's not as simple as, are you suffering from depression? Are you suffering from racism-related stress in addition to your depression? As a doula, the primary role is to supply the mother-to-be with education, mental health resources, physical resources. When we're breathing and focusing on our breath, we're taking our minds off of the other things.
The mental health journey and seeking the help of a therapist was difficult. I didn't feel a therapist who wasn't Black, a therapist who wasn't a woman, would be able to really understand the ways in which I uniquely experience the world. Because of that, I felt like it was really important to make sure that I had an established person in place and a relationship with a mental health provider, because I want to be able to continue that.
Right now in LA, Black women's maternal health mortality is 4.4% higher than white women. That situation just speaks to the bigger issue for the racism that exists in the medical system.
After my first miscarriage, I felt, well, maybe I'm just never gonna be a mom. Of course, now I feel very far away from that point. The bad things that have happened don't define me.
Beautiful. 1, yes, mama, so powerful. 4, 5, 6, 7, 8, 9, 10.
And breathe.
Oh my